Please subscribe and hit the bell icon so that you will never miss any video from Acuere Life Science Foundation. Dear students, today we will talk about the basic concepts of blood pressure. What is blood pressure? In a simple language, blood pressure is a pressure exerted by the blood on the wall of the arterial tree. It is the pressure exerted by the flowing blood over the wall of the artery. All of you know, when the heart is in systole and the blood pressure gets generated, that we will call systolic blood pressure. When the heart is in diastole and the pressure generated will be known as diastolic blood pressure. How systolic blood pressure generates? The systolic blood pressure generates by the systole of the heart and is opposed by the elastic wall of the vessel. The heart is trying to pump the blood and this pumping is opposed by the peripheral tree. The peripheral arterial tree is elastic. Heart contracts and it is opposed by the pressure, the force is opposed by the elastic wall of the vessel. The pumping by the heart and opposed by the elastic tree of the vessel is responsible for generation of pressure, and that is what we call systolic blood pressure. By the definition, systolic blood pressure is a product of cardiac output multiplied by total peripheral resistance. And in simple language, you may say that systolic blood pressure is concerned with the force of contraction and TPR. Now, the heart will go into diastole. What happens in diastole? The heart relaxes. The aortic wall over the left ventricle will close. Now, at the time of systole, when the heart contracted and the peripheral tree expand, now this expanded tree will put the pressure over the blood and the blood will come back. It will come back up to the aortic wall. Aortic wall is closed. Now the elastic wall of the vessel is putting the pressure and the aortic wall is opposing it. This will be called as diastolic blood pressure. I am repeating. The elastic wall of the vessel is putting the pressure over the blood and it is being opposed by the closure of the aortic wall. The pressure so generated will be called as diastolic blood pressure. Now, in short, we will see what is the effect of this systolic blood pressure. When the blood pressure rises, why the blood pressure rises? The blood pressure rises generally due to either constriction of the peripheral blood vessels or peripheral atherosclerosis or atherosclerosis in the peripheral vessels. The lumen becomes small because of the atherosclerosis. The lumen becomes small and through that small lumen, heart has to pump the blood with more force to fulfill the demand of the peripheral tissue. And that's why heart has to pump the blood with more force. When heart has to pump with more force, heart has to increase its pumping capacity. When I am using the word heart for pumping, actually the left ventricle pumps the blood. When the left ventricle has to pump the blood with more force, it has to increase its size. The size of the left ventricle will increase. And this increased size will pump the blood with more force, and this is how the systolic blood pressure will rise. But at the same time, the size of the left ventricle has increased, but coronaries are the same. Coronaries are there, coronaries are atherosclerosed. Why? because the cause of hypertension, which is atherosclerosis in the peripheral vessel, will be present in the coronary vessels also. Now the coronary is the same, but it is atherosclerosis, and demand of the heart due to hypertrophy has increased. And that's why the heart is requiring more blood and supply is reduced. Why supply is reduced? Because of the atherosclerosis. And this is how there will be imbalance between demand and supply. Now, we will talk about diastolic blood pressure. In the systole of the heart, every organ on the body receives the blood, except heart itself. Heart itself receives the blood at the time of diastole. At the time of diastole, the aortic wall closes. Just above this aortic wall, there is a branching of coronary. The blood which is being pressed by the peripheral tree and opposed by the aortic wall will rush to the coronaries. And that is how heart is the only organ in the body which receives the blood at the time of diastole. During the diastole, the coronaries are atherosclerosed, demand is high, and now the blood is being pumped in the coronaries by the pressure of the peripheral tree. If the diastolic blood pressure is more, the blood will rush to the coronaries and it will result into dislodgement of the atheromatous plug. And this case will be a case of acute myocardial infarction. Now in short, systolic blood pressure is responsible for left ventricular hypertrophy, which in turn is responsible for increased demand and will result into ischemic heart disease, which you may call it as a long-term complication. But because of the diastolic blood pressure, there are chances of removal of the or dislodgement of the plug in the coronary, which will result into acute myocardial infarction, which is the acute or immediate complication of the raised blood pressure. This is how the systolic blood pressure is related with LVH and LVF, and diastolic blood pressure is more concerned with acute myocardial infarction. And this is how systolic blood pressure is dangerous as well as diastolic blood pressure is also dangerous. Overall, hypertension itself is having multiple complications. I am just talking with you about the complications related with the heart, and we have covered only two complications of hypertension. One is IHD and one is acute myocardial infarction. If you want to go in detail of it, we do arrange the 2 days training program, teaching program of hypertension. For the details, please log on to www.oxfordmedicalacademy.com. Thanks for watching. Please subscribe, like and share so that you will never miss any video from Acuere Life Science Foundation. Thank you.